First, most important thing I tell my patients, breast augmentations are very, very, very safe. These are great operations with at least a 98% patient satisfaction. So they are great, but there are some issues that you should know about. And the three major sort of reasons somebody would have to go back and have surgery because of a complication would be a capsular contracture, which means scar tissue forming around the implant, size change, meaning they don't like the size and you have to go back and change the size, which is one, and then implant malposition. One implant or the other are malpositioned, or maybe both. They're not where they're supposed to be. All three of those can necessitate having another surgery. And so we try to avoid those. So when it comes to malposition and capsular contracture, I find the use of texture, especially the Sientra True Texture, as being very beneficial by reducing the capsular contracture rate significantly, as well as controlling the position of my implant. And for size changes, we try on implants and we do computer imaging so the patient has a vision before surgery of what they're going to look like. And I make a promise to them that I will not change what we decide together. Capsular contracture still continues to be a major concern to my patients when they come in. They often read about it on the internet or talk to friends about it. And it has been the major sort of complication we've seen with breast augmentation. So everything we can do to reduce that likelihood is very, very important. And for me, texturing with the Sientra texture uniquely reduces that capsular contracture rate down to 2%. What's even more important, they actually created a program called the C3 program. It's a little bit of a warranty program for my patients that if they get a capsular contracture and they've used a textured implant in a breast augmentation from Sientra, they will provide a free Sientra implant to exchange at the time of their surgery to deal with the capsular contracture. And that's, I believe, because Sientra believes that they're going to see very few capsular contractures in the first 2 years with the use of their implants when it's textured. Silicone implants have very low rupture rates over time, especially in the first 3 to 5 years. We do see the rupture rates go up after 5 years, up in the 7 to 10 year range. The most important thing about a rupture is that if you have a small rupture, it doesn't pose any health risk to the patient, and so it's not an emergency. But if I know an implant's ruptured, I at some point in time would ask the patient that we should probably change it and put an implant that's not ruptured in. So I think the most important thing is that when a patient has a silicone breast augmentation, they continue to have an ongoing relationship with their plastic surgeon. Because with the routine use of mammograms and ultrasounds, which patients are getting anyway to look for breast cancer, as well as a good physical exam by the surgeon, they can often discern any important rupture of a silicone implant. When I ask them not to exercise for 3 to 4 weeks after surgery, I think it's very, very important. And I think it's even more important when I use textured implants. With smooth implants, I have my patient massage that breast because to keep a smooth breast augmentation soft, you need to massage and keep the implant moving. Quite differently, when I do a textured augmentation, we do not want the patient to massage. And that's an absolute. So we have them do early stretching movements and stretching and exercising, but not massaging their breasts. So they're different. So we do ask them to do that. They have to wear a sports bra for a month and for 6 to 8 weeks at bedtime, because I do think that some control of swelling and sort of the position of the implant is very important until the capsule's formed, and so we ask them to do that. I like them to refrain from smoking if at all possible. They can't get into submerged water for 1 month. We also ask our patients to take vitamin E for 1 year after surgery. I think the data on that's soft, but I think I've always done it. I think it potentially helps reduce the likelihood of capsular contracture. I also think vitamin E is good for you anyway as an antioxidant. So for all those things, I think that the patient does partner with us, and we do ask them to do some things to help get the best result for their breast augmentation.